Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. My name is Rabiatul Adawi Abdurrahman, and I am excited to be here today to share my research findings with you all. So, first of all, I want to express my gratitude to the organizer for giving me this opportunity to present my research at this conference. The research title I am presenting today is Exploring Perceptions of and Willingness to Use Telerehabilitation During the COVID-19 Among Physiotherapists in Malaysia, a cross-sectional study. So these are the outline of my presentations. So I will start with the introductions and then methods, result and discussions, and conclusion. I welcome if any of you have questions at the end of my presentations. Okay, so let's start with the introduction. So the COVID-19 pandemic has caused a devastating impact on healthcare system worldwide, include our country, Malaysia. So during that particular pandemic, okay, physiotherapy is essential for the acute and post-acute rehabilitation of COVID-19 patients, as well as the maintenance of rehabilitation for older and disabled people. Okay, so if there is any cessations of interruptions or delay in this rehabilitation service by the physiotherapist, so it can lead to the deterioration of patient health conditions. So what happened next is it will cause increasing the numbers of disabled people in the future. Okay, so the continuity of physiotherapy service still needs to be maintained with some modification as it is one of the essential services. Telerehabilitation is a modern innovation, okay, that explored more during that particular pandemic, COVID-19. Okay, so it is a modern innovation used in delivering rehabilitation services at a distance by using telecommunication technology. So by using this platform, okay, physiotherapists may communicate with patient via video conferencing, okay, messaging or other forms of communication technology. So there is a few software or applications that are available for telerehabilitation, such as Zoom at that time, and another few of the software and application. So it was considered a suitable alternative healthcare delivery system during the COVID-19 outbreak. However, the acceptance and implementation of telerehabilitation are a tribute to the attitude and willingness to utilize new technologies. Okay, so there is a gap in the literature addressing physiotherapist perceptions and willingness to employ telerehabilitation in Malaysia, particularly during the COVID-19 pandemic. So the purpose of this study was to investigate physiotherapists' perceptions of telerehabilitations and their willingness to use it in Malaysia during the COVID-19 outbreak, as well as we want to identify what are the barriers to effective telerehabilitation adoption in the field of physiotherapy. So let's proceed with the methods. So for the study design, this is a cross-sectional study survey among MPA or Malaysian Physiotherapists Association members. So a self-report questionnaire was adopted from the previous research. Okay, the questionnaire included a few sections, including participants' profile, technological background, perceptions of telerehabilitation, comfort with technology, willingness to use it, and also barriers to using telerehabilitation. So participants included in this study using the convenience sampling method. Okay, and a sample size of 285 was obtained based on the Craigie and Morgan table. Okay, so this study included MPA members, which is the inclusion criteria is physiotherapists with at least 1 year of clinical experience, and participant also consented, so they are voluntarily participate in the study. So for the procedure, a survey was developed via Google Form to collect data from the physiotherapists. So basically, this form has been distributed through the MPA social media, official social media, between June to July 2022, which is 2 months period of time. So a total of 231 physiotherapists, which attribute to 81.05% acceptance rates. participate in the study and complete the questionnaire. So the study also have approved by the research committee, research and ethical committee from the Faculty of Health Science, UITM. So for the data analysis, all collected data basically were analyzed using the SPSS. Okay. So the analysis consists of descriptive statistic to express the result in frequency and percentage, chi-square test, to evaluate or examine the association between the physiotherapist field of practice, internet usage at work, and readiness to use telerehab during the COVID-19 pandemic. So the significance level was set at P less than 0.05. Now let's move on the result and discussions. So first we look at on the participants' profile. So the result shows that approximately over half of the participants were under 35 years of age, and most of them were female. Okay, so most of the participants were in the area of orthopedics as compared to another area, with years of working experience 4 to 11 years. So the result also shows that most of the participants were from the university hospital in Malaysia. Okay. Okay, next is technological background. So these sections, investigate the physiotherapist's computer and information technology usage, such as using the internet, email, and telemedicine application. So most participants frequently use the internet at work, and about 82.6% use computer. Okay, over half of the participants use email frequently at work, and most respondents basically never use telerehabilitation system at their work. Okay. Okay, next we look at the perception of telerehabilitations. Okay, so basically the vast majority of participants um, concurred that information and communication technology (ICT) might play a role in the provision of healthcare. So most participants, which is 86% felt that telerehabilitation is a practical approach to providing physiotherapy services to patients. Okay, most respondents, about 92.8%, said telerehabilitation might result in time and cost saving. According to more than half of participants, 83.5, telerehabilitation should lighten the workload for physiotherapists. Finally, over half of respondents stated that the application of healthcare ICT is available in their hospital or centers. Okay, so basically this study indicate that physiotherapists in Malaysia had a positive perception of telerehabilitation and an interest in acquiring the skills required to implement telerehab in the workplace. So the majority of participants agreed that telerehab is a viable option for providing patients with physiotherapy service, specifically during the COVID-19 pandemic. So this finding is similar to the previous studies that have been conducted in Kuwait, India, Brazil, Belgium, Ireland, and Sweden, that found physiotherapists have positive perception or views of telerehabilitation. Okay, so this positive perception of the system reveals significant advantages in different aspects, including minimizing the cost, and travel time, and reducing physiotherapy workload. So telerehabilitation flexibility makes it possible for physiotherapists to use this application to help patients during the COVID-19 pandemic. Okay, next we look at on the willingness. Okay, willingness to use telerehabilitation. The finding shows that the majority of respondents, 91.2%, were content to use telerehabilitation system, to approach other medical facility or hospital for consultations. Additional, the majority of physiotherapists, about 90.9%, were ready to provide telerehabilitation services. Field of practice and readiness, so basically based on this figure, we show that most of them are willing to use the telerehabilitation, particularly during the COVID-19 pandemic. Okay, so basically from this study, it is demonstrated that the majority of physiotherapists were happy actually and willing to do physiotherapies remotely using telerehabilitation. Okay, this result was consistent with the previous study in which the physiotherapists were willing to use telerehab during the COVID-19. Okay, providing a face-to-face session actually for an early assessment and intervention. Okay, we provide the face-to-face first before proceeding with telerehabilitation. It is a way, okay, it can be a way to improve the readiness and effectiveness of the treatment session when this telerehabilitation is being implemented. Okay, next we look at the association between field of practice, internet usage at work, and willingness to use telerehabilitation. So basically, field of practice and willingness to use telerehabilitation system were not shown to be significantly associated. So there was a significant association actually between the internet usage at work and willingness to utilize telerehabilitation. That it is suggesting that the more frequently physiotherapy used the internet at work and felt more comfortable using the technology, the more willing they were to adopt this system. Okay, now we look at the barriers to using telerehabilitations. Okay, so based of these figures, as we can see, the common barriers identified in this study as obstacle to using telerehab. Okay, most of the prevalent barriers highlighted by respondent, okay, was a lack of appropriate equipment training, okay, about 57.2%, and user-friendly software, okay, 47.6%, expensive equipment, 49%, and patient privacy and confidentiality, okay, 47.6%, all of which could lead to reluctance or refusing in using and learning the system and technology. Okay, so several main barriers identified that I have mentioned earlier. So limited ICT equipment and facility are considered technological barriers and significant obstacles that may prevent physiotherapists from using this telerehabilitation system. So what we can do is having a good connection between healthcare and ICT experts, proper training delivery, and good infrastructure could overcome this limitation. Another concern in this study evolved on patients' privacy and confidentiality when using the telerehabilitation platform. Okay, the potential resolution or solution for this concern is by developing policies and regulations for telerehabilitation practice to ensure that the safety of both parties, patient and physiotherapist. Okay, so the previous finding revealed that it is a very crucial to provide legal clarification to patient that treated through the telerehabilitation and keep the data in the cloud or backup. So as the conclusions, okay, the study showed that most physiotherapists in Malaysia have positively perceived telerehabilitation and are willing to use these applications to provide service during the COVID-19 pandemic. The study has provided preliminary information regarding the use of telerehabilitation in physiotherapy practice. So decision makers in healthcare should evaluate the use of telerehabilitation and develop specific policies and guidelines to manage telerehabilitation services in Malaysia. To assist the adoption of telerehabilitation for physiotherapy service, it is recommended that technological and organizational support be provided to resolve the technological needs and to establish the necessary policies. Okay, so these are the acknowledgement for my research. Okay, the researchers express gratitude to the MPA members who participate in the study and UiTM Cawang Pulau Pinang for the support. There are references a list, and thank you. Okay, thank you for your attention. Okay, about 14 to 15 minutes. Okay, bear with me. Okay, so that's all from me. Thank you. And that's if you have any question, okay, you can ask me. Okay, that's all. Assalamualaikum warahmatullahi wabarakatuh.